In the previous video, we discussed this manual technique known as tibiofemoral traction, or just simply knee traction. And this is a manual technique that's very useful for patients in the clinic who are suffering from knee pain due to osteoarthritis. We talked about how you do the technique and so on and so forth. And at the end of the video, I touched on this fact that we always use the test, treat, retest model. So what would the test be? Well, the test would be maybe pain level in the knee while walking. So you have the patient get up and move around the room, and let's say they rate the pain in their affected knee as 5 out of 10 severity. So then you treat them. You do this tibiofemoral traction. And how do you know if it works? Well, you had to test in the first place, and now you retest the same thing. You get them up moving around the room, preferably the same path that they walked the first time. And if it worked, well, then the pain severity should be lower. Let's say it went down to a 2 out of 10. Okay? So if their pain level is reduced following this technique, well, it'd be nice if you could give them a technique to do at home that reinforces this. Well, there is one. And so this tibiofemoral self-traction is a very useful exercise for helping patients deal with knee pain at home, but it's only useful if the manual version of this done in session actually reduced their pain. And again, you would know that if you followed this test, treat, and retest model. Okay? This technique would not be useful at home if you did this manual tibiofemoral traction in session and it didn't do anything for the patient's pain or made it actually increase. Okay, so if traction in session was useful, then you can give them the self-traction technique for home. Let's go over it right now. Now recall from the previous video that tibiofemoral traction, also called knee traction, is a useful manual technique that you can do in session for patients who are suffering from knee pain due to osteoarthritis. Now most manual techniques are very difficult to reproduce at home for the patient, but this is one where it's actually pretty straightforward. Now, if you go back and watch the video on tibiofemoral traction, you'll see that the patient was in prone and we had their knee approximately at 80 degrees of flexion when we were applying the traction force. So this actually replicates that traction fairly well. So you'll see here that I've got an ankle weight wrapped around this ankle. So I'm doing traction on my right knee. The ankle weight I'm using here is 10 pounds. Again, the exact weight that's going to be used for the patient depends on the patient, but for the most part, I found that 10 pounds actually works very well. You simply strap the ankle weight around the person's ankle and you just have them sit here. At home, the patient can watch TV. They can do anything while they're sitting, right? The two downsides or cons to this, or I guess you could call them considerations, is that one, they have to be able to sit on a surface high enough to where the foot is off of the ground. Okay, so most regular chairs are not going to work for this. So they might have to sit on a table to do it, or if they have an armrest of a couch that's high enough, they could do it that way as long as it's safe. The other thing is that they probably have to buy an ankle weight. I have some links in the description of this video for ankle weights that you can purchase on Amazon that are adjustable. Take a look at those. But this is a really good technique that you can use for knee OA. Usually I'll have a patient start out doing this for 5-minute intervals, and then based on tolerance and how much it helps them, you can always increase the duration of the self-traction. Thank you for all your support. Be sure to check out my Instagram for cool science and not science stuff.